to in the past. And I should also mention that this session is also going to be recorded and posted on YouTube. So, as I said, my name is Alex Cullen. I'm the president of the Federation of Citizens Associations. I'm being asked to moderate this town hall. I don't expect to do a lot of talking. That I think belongs to Melissa. But as I said earlier, I would like to thank her and her team for providing this opportunity. Today is the last day for advance polls. They close at 9 o'clock tonight. Tomorrow is the last chance to mail in a ballot. So if you're not able to do either of those things, then voting happens on Monday between 9:30 a.m. and 9:30 p.m. And you should have your voter card. If you don't have your voter card, please contact Elections Canada to find out where to vote. So tonight's format's relatively straightforward. We're going to start off with some comments from Melissa. I believe she has a presentation on her campaign. And once we're past that, we're going to take questions from the chat. So my job as moderator is simply to read out the questions. I may edit from time to time to make sure that we get as many questions as we can. I may end up combining some questions. So please forgive me if I don't repeat all of the wonderful comments that are out there, but we want to answer as many questions as we possibly can. So at this point, without further ado, I'll ask Melissa to introduce her campaign.
Great. Thank you, Alex, and thank you everyone for coming on tonight and taking time out of your schedule to be here and hear about the NDP's platform and campaign for Kanata-Carleton. So I'm going to start with telling you a little bit about myself and who I am. That's probably the #1 question that I get is, who are you? So I'm a mom raising my son here in Canada. He's 12 years old. I'm a healthcare worker. I've worked at the Ottawa Hospital, between the Ottawa Hospital and CHEO for the last 18 years as a laboratory technician. I've been a union president, vice president for 2 years, and president for 4 years, representing 16 hospitals across Eastern Ontario, and spent much of my time dealing with safety concerns in hospitals. So I'm very familiar with hospitals and how they run. I've been advocating for the expansion of Medicare probably for the last 10 years. Seeing the advantages in other countries, it just seems to make sense to me. So that's what's kind of brought me to get into politics and trying to make those changes for people. So we'll start the presentation. I'm going to go through a bit of our platform with the main things that I'm hearing in Kanata-Carleton, and hopefully we'll answer some of your questions. And if it doesn't, then we'll leave the question period open for anything that we've missed. So the first thing I want to talk about is pharmacare. Pharmacare has been present for multiple elections now, and it makes sense to me financially. It makes sense to take care of Canadians. It keeps people out of emergency departments. And if you think about the government paying for someone's insulin, for example, $100 a month for insulin, it's a lot more cost effective in keeping that person healthy versus the approximate $20,000 it can cost for the hospital stay to get them stabilized and then back out into their homes. So that's the kind of thing that Medicare will help with. And I'm really excited that the NDP and Jagmeet has really put in an ambitious plan to work with the provinces right away to be able to roll this plan out in 2022, not in 4 years from now, not in 5 years from now, but in 2022 to start helping people to take advantage of it. And it's going to save people roughly $500 a year. For some people, it will save them quite a bit more. And for other people who need it less, it will save you a little bit less, but on average, $500 per year. We also want to include dental care into our Medicare for anyone that makes under $90,000 a year. That will also help keep people out of emergency departments. There's many emergency surgeries that show up in ERs every single year for people that can't afford dental care. And really the whole foundation of this, there's lots of countries, New Zealand, for example, that have implemented pharmacare and do take time to break down what works and what doesn't work. But they are claiming and saying that with the implementation of pharmacare, that it does save the country money in keeping people healthy. It keeps people working. It keeps people, having that surplus income to go back into the economy, and it keeps them out of hospitals. So that's good for everyone. So the next thing that I want to touch on that is top of mind for a lot of people here, especially in Kanata-Carleton, is climate change. We have seen extreme weather events here in Kanata-Carleton, flooding, tornadoes that have touched down, and it's really been catastrophic for some families. So we need to take immediate climate action. And the federal government is looking to reduce our GHG emissions by 50% by 2030. And how are we going to do that? We have to start right away. And I'm really excited to hear the NDP say that they're going to start with federal buildings, because city cores and city centers are generally the biggest emitters. And it's the most dense populated area, so it does make sense. So the federal government knows that people are coming out of the pandemic, and that not everyone can afford to retrofit their own homes and spend their own money. So to start, the NDP and NDP government would start with federal buildings and federal fleets of vehicles and making them zero emissions, and then giving Canadians time to recover from this pandemic. And the difference between, people always ask the difference between us and the Liberal platform on this regard. The Liberal platform is going to offer you $5,000 to retrofit your home. And the federal government is just going to start retrofitting. The NDP is just going to start retrofitting federal buildings. The NDP is also going to offer families $15,000 a family to purchase a zero emission vehicle if they're able to. The Liberal government currently is offering $5,000 for zero emission vehicles. So we understand that for some people, 5,000 is not quite enough. So we're upping that to 15,000. We're also in trying to get zero emission vehicles on the road and combustion engines off the road by 2035. We need to invest in charging stations all across Ottawa, all across Canada. If you're traveling, you need to, just like finding a gas station, you need to be able to find a charging station. So we know that, and we're going to invest in that. And with that, you need to invest in upgrading the electrical grid as well. And all of these kinds of things will create jobs, which will help areas, especially Ottawa. There's a lot to be done here, and really just help with getting people back into work post-pandemic. And we also have quite a bit of research and technology that needs to be developed for a lot of these initiatives that the NDP wants to do. So that will create a lot of technology jobs as well. We need to cancel the pipeline. We're going to cancel the pipeline. The Liberals and the Conservatives both want to continue investing in the pipeline and continue offering subsidies. And the NDP wants to cancel the pipeline and immediately shift to as much green technology as we can. So with that, we're going to invest in public transit, green public transit, which for Ottawa would consist of light rail. Coming out to Kanata, we're the last stop on the train here. No pun intended, but it's really unfortunate, but we are the last stop. But it is going to come out to Moody Drive, and then the NDP would invest in it coming all the way out to Kanata. And my desire would be that while that's in progress, that we look at talking to the municipality and the province and getting it to come out to Stittsville, getting it to come out kind of beyond, because as we know, Kanata is spreading out, it's expanding, and we need to look at those investments as well. It can't just stop in Kanata. It needs to connect our smaller municipalities as well. In Ottawa with green transit, we would be looking to support the transition to electric buses. I know that the city is already looking at those contracts, and an NDP government would help cities like Ottawa invest in electric transit for buses as well, to make all city transit green, which would be amazing for a city the size of Ottawa. So I'm excited about that as well. So further to climate, we need to look at reconciliation. And really with reconciliation comes reconciling with the earth. So I feel like reconciliation and climate really go together, in my opinion. And in reconciling with our Indigenous Canadians, we need to fully implement the 94 calls to action. Currently, only 6 of the 94 calls to action have been implemented by the current government in 6 years. That's only 1 a year. It shouldn't take us 94 years to get Indigenous peoples clean drinking water, to get them safe and full educations, to get them infrastructure in their communities, to have consistent, safe drinking water. So that is something that Jagmeet has been very clear about, and the NDP has been very clear about, that it needs to happen. And the conversations with a lot of the chiefs have been happening, and we need to get that started right away, because we're hearing right from these communities that they don't have safe drinking water. They're drinking out of bottled water. They get allocated 1.5 liters of water per person in the household per day. And a lot of people can drink more than that, but that is all that they are given. And that's really not acceptable for Canada, for a first world country. We have the capacity, we have the ability, we have the resources to get these people clean drinking water, and that's what the NDP is committed to. I think that we need to really look at the efforts of reconciliation that the current government has done, and just do a lot better. We're going to take the survivors of residential schools and get them out of the courts. They were awarded a settlement and immediately taken to court by the current government for that settlement. We need to stop that. We need to reconcile with these people what they have been awarded, and start that process with them. Because if we're fighting them, we're not really working towards reconciliation with them. We're working against them. And it's kind of insulting, in my opinion. So that's definitely something that is top of mind, and Jagmeet has talked a lot about, and really hits home for me, because I can't imagine raising my son in some of the conditions that these people have to raise their families in. And when we really when we invest in these families and we invest in these communities, they can start to thrive, and we'll start to see that in these communities. We'll see that they'll be proud of where they live and proud of where they're raising their kids, and they'll get to keep their culture, and it will really become sustainable, thriving communities. We just need to start investing. Next, after that, I want to talk a little bit about seniors' care. People have, through this pandemic, really been thinking about how are we taking care of our elderly, whether it's putting them in long-term care, and how can we stabilize long-term care for seniors and make sure that they're getting the care that they need. We need to have a national senior strategy. We need to know what they need. Our pharmacare plan will help them not have to pay for those medications, for those that do pay for the medications. But we also need to look at bringing long-term care homes into non-for-profit situations. In the last year during COVID, long-term care homes that were for-profit paid out dividends of $78 billion instead of paying their staff more, instead of investing in PPE, instead of ensuring the safety and well-being of our loved ones in those communities. They paid out dividends to their shareholders, and it's awful. It was tragic what happened in long-term care, and we need to make sure that that never happens again. And creating a situation where they're not for profit and their end goal isn't to make profit, but to actually care for people, we will get to that place where they're caring for people more than they're focusing on making profit. So that's the number one thing in taking care of our seniors, especially in long-term care homes. But we also have to make sure that the seniors that want to live at home can stay at home for as long as they can. And affordable housing will help them stay in their homes. Pharmacare will help them be able to have the finances and the resources to stay in their homes for longer. Ensuring that we have transit to get them around will help them stay in their homes. And then when they do have to transition into long-term care homes, we need to make sure that every senior has that opportunity, because right now not everyone can afford that because of the for-profit portion of it, that it's quite costly. So we want to really integrate it into something that's available for all seniors and that there aren't wait lists. And the other thing that we can do for seniors is really help to protect their pensions. I mean, we all remember what happened with Nortel when they went under, what happened with Sears when they went under, and people who had worked for these organizations for their entire careers were now not going to be paid their pensions, but yet dividends and bonuses were being paid, and then bankruptcy is claimed. So we need to make sure that that doesn't happen to people, that pensions are protected, and that they have to be appropriately funded before any sort of bonuses can be given out to anyone up the food chain, really, because that way, when people do retire, they aren't retiring directly into poverty. And that's what we have seen happen. So the NDP wants to make sure that that does not happen to any Canadian that's worked hard their entire life. And we're going to move on to affordable housing. Affordable housing, as we know, like in Canada, houses in some areas have completely doubled in price. They're unaffordable, they're out of reach, they're unattainable for a lot of people. Students are graduating with master's degrees and PhDs, and I've gotten some emails where they've said, like, I'm not sure what I'm supposed to do. I have all this university debt and I definitely can't afford to buy a house right now. It's just really out of my reach. How am I supposed to start a family? You know, how do we get to this place? And so it's very real for a lot of people. We've heard a lot of people say at the door that they're very concerned about their children and how what their children are going to do that are currently in college and university when they graduate. So the NDP is going to put a 20% foreign buyers tax on any foreign buyers purchasing property in Canada, because as we know, a lot of the reason why the housing market started jumping up is because foreign buyers were coming, they're investing in property here just to have their money invested. And so they're paying way over asking, sight unseen, for properties and then leaving them empty. And therefore, all the houses in that neighborhood are going to go up in price because of that one house or two houses that were bought at that higher price. And we need to plateau that. We need to stop that, because if that continues, we're going to be like Vancouver. We're going to be in a situation where you're handing your house down through generations so that they have somewhere to live. We're also going to build affordable housing units. Now, the NDP has committed to 500,000 units all across Canada, but 20,000 of those are going to be here in Ottawa. And I'm excited that out here in Canada, we actually have space, we have some land, and it's very reasonable to have some of that affordable housing built right out here in our riding. So that's going to really help people as well to be able to get into the housing market and to be able to stay in the housing market at a price that's affordable to them. And we need to work with the municipalities on that as to where these houses are going to go. But that's something that I'm very committed to do here, working with city council here in Ottawa, as well as provincial, but city council here in Ottawa, and really the city planning committee, because they have a say in where some of this housing goes to. And I think that that's something that's really exciting for Kanata-Carleton, because we have the room and we need the housing space out here. We also need to look at really investing in more co-ops. We have a couple here in Canada, but it's kind of something that's gone by the wayside for a while, and it's something that municipalities are now looking at bringing back. And so the federal government is looking at helping with those style of housings as well. So that is all I have for my presentation. These are the main things that we're hearing about at the door, but let's open the floor to questions. I guess I'll turn that back over to you, Alex.
There we are. Okay, so we're playing with new technology here, but it's working, and it's always good to know. So folks, as mentioned earlier, my name is Alex Cullen. I'm the moderator of this event. My job is to make sure that we get the questions to Melissa, give Melissa the opportunity to answer them. We have some questions that have already come in. If you do have a question, please put it through the chat function. From time to time, I may combine some questions because they overlap, but we'll try and get as many people as many questions as we can to Melissa as possible. So Melissa, we're in the middle of a COVID pandemic. We're into our fourth wave. We hope to see the end of this. What's the NDP's plan for COVID recovery? How are we going to help our society, our economy get out of this?
Yeah, that's a great question. And I think the first thing that we have to do is get people vaccinated who want to be vaccinated, who can be vaccinated, because I do understand as a healthcare worker that medically not everyone can be vaccinated. Get people vaccinated, and we need to get people back into the workspace, which is a bit harder than it sounds for a lot of people right now. Childcare is a big barrier for a lot of families finding a space and having it just be affordable. Childcare in Ottawa can be upwards of $1,200 a month for one child, which for a lot of people is unattainable. So the NDP is offering to get all the provinces, 8 provinces are already on board with $10 a day childcare, including Quebec, as a lot of people know. And the number of women back in the workplace in Quebec is far greater than here in Ontario. So it does help get people back in the workplace, and we need more spaces available. So $10 a day childcare is going to help get people back in the workplace. We know that there are jobs available right now, businesses are reopening. And so the NDP is also going to help with some training of new staff for organizations, so that they can get their full fleet of staff back up and running. And then as people get back to work and they can find the childcare and get back to work, it will really start the economy back up, because it will give families the opportunity to have a little bit of disposable income. And as people have disposable income, then they have that opportunity to go spend it in our businesses, and then our businesses do better, and then they can hire more people, and then the cycle continues of the economy getting back up and running. And so that's really kind of the start from what the NDP sees, is really just making going back to work accessible for people.
Great, thank you for that. I do have a question that's come up about the NDP climate change plan. And is there a role for nuclear energy in the transition to a green, low carbon economy under an NDP government?
Right, that's a good question. We're hearing a lot about nuclear energy, and I think that there is room for a lot of things. And what I'm excited about that the NDP is offering is a lot of research into the technologies that are going to be the most sustainable and the most green in Canada. And that's where a lot of the business, a lot of the jobs are going to come from, because we need to, some of that information is out there and some of it isn't. Like, we know that electricity is out there, but our grids are not ready. So would nuclear be a better way to go in the short term? It very well could be. So nuclear is out there. We're talking about it. It's definitely an option, and we need to get that research done to see, and if it's a sustainable resource, which we know it is, then we'll be able to use it for sure.
Thank you for that. And the question: the NDP over the weekend announced the full costing of this program, some $200 billion. The question is, how does the NDP expect to pay for this very ambitious program?
Right. Yes, our costing did just come out, and there was a really interesting analysis of all of the plans costing. And I'm really excited that the NDP does have a plan for that. So we are going to, first of all, close tax loopholes. You know, all these businesses that have all these loopholes where they can write stuff off, put stuff in what they call investments in other countries, offshore accounts, whatever you want to call them. We're going to close some of those loopholes so they have to account for all of that income. And we're going to tax the wealthy, anyone who makes over $10 million, the first 10 million tax same as usual. The $1 over 10 million and anything up to however much you make, you're going to be taxed a little bit extra on that. And that's going to equate to about $166 billion per year. And they're going to take that money and they're going to invest it back into all of these programs that they're rolling out.
Thank you for that. So a question here, there's a lot of talk about the similarities between the NDP and the Liberals. For example, both are talking about pharmacare, both are talking about publicly funded childcare. Are the NDPs simply Liberals in a hurry? What do you say to that?
Well, I would say it was the opposite, because our platform came out first, and it was almost 4 weeks later the Liberals platform came out, and there are similarities for sure in them. I think the difference is we're not in a hurry. We just understand that Canadians need these things to get back on their feet, and we're going to implement what Canadians need. And we're going to find a way to pay for it all. So pharmacare has been on the NDP's platform election after election. I mean, it's also been on the Liberals platform. I mean, they promised it in 2015. They promised it in 2019. They're promising it now. And in 2019, if I recall properly, they said it'll take us 5 years to get it up and running. We have to do research. We have to cost it. And they're not really giving a timeline this time. From what I understand, they didn't do very much with it in the last 6 years that they had it on their platform. So I don't know if Canadians want to wait another 5 years for it. It is doable very quickly. There is a framework in other countries that have done this. We're not going to reinvent the wheel. We're not in a hurry. We're going to do it properly, but we do have the ability to get it done and get it rolled out in 2022. We're just listening.
In the last week of this campaign, like many other elections, we're going to hear a lot about strategic voting, voting for one party to stop another. And so what do you say to the issue of strategic voting?
Yeah, it's interesting. We're hearing less about strategic voting this round than I did as a candidate in 2019. But what I would say to that is a couple of things. First, that if you're voting to keep another candidate out, you're voting out of fear. You're voting out of fear. You're not voting for the candidate that you want in. You're voting for the candidate you want to keep out. And that's really telling the Liberals a vote for the Liberals. I'm hearing a lot of people say they want to keep the Conservatives out of government. So if you're voting for the Liberals, you're really endorsing the last 6 years. You're endorsing 3 trips to the ethics commissioner. You're endorsing the statement that they will get pharmacare up and running year over year over year, and they don't. You're endorsing the fact that Indigenous Canadians don't have clean drinking water. You're saying that all of those things are okay. The more we support the Liberals trying to keep the Conservatives out, the more we're condoning their conduct. We're condoning everything that they have done, and we're saying it's okay. You don't really have to work hard for our vote. We're going to vote for you anyways because we're afraid of the other guy. And so we're going to end up back in this situation that we're in election after election and people are voting out of fear instead of voting for change, instead of voting for better, instead of voting for a prime minister that's not going to embarrass Canada. So that's what I would say to strategic voters. You have to vote your conscience. We aren't going to make any changes in this country if we don't start voting differently.
So on a very different tack, we've heard a lot about pharmacare, childcare, COVID, reconciliation, affordable housing. What about the economy?
What about the economy? I mean, it comes back to our pandemic recovery, really. In order to get the economy back up and running, we need to have people with income to invest in the economy. We need to have people with that disposable income to invest in the economy. It's very cyclical. That's how it works, right? We invest in the economy. You go out for dinner, you're investing in that restaurant. That restaurant can then pay its bills. It can hire more staff. It can expand. Same thing. We have extra money. We buy zero emission vehicles, and then that industry can hire more people and it can expand. That's what it takes to get it up and running. So we really need affordable childcare to get people back at work And those people that get back at work are also paying taxes, which goes back into the economy for our social programs and for our roads municipally and everything else. We need women to be able to get back in the workplace. We need schools to stay open. We need to keep everyone healthy. With pharmacare, we're going to be able to do that, and then the cycle continues. So social services and daycare will get us back on our feet. We'll get people back in the workplace. We'll get them disposable income. We'll get them spending that money, and we'll get the economy back up and running.
Thank you. So another question I have that's come up through it has been presented is the issue of student debt, university student debt. It's become large and a barrier to not only people going to university, but starting out after they graduate. What does the NDP have to say to that?
Yeah, that's a big problem. We're hearing a lot about that. Our cost of education here is very high, and it is going up year over year, even though people are staying home and really doing online schooling. But the NDP recognizes that, and we are looking to do a debt relief program because we understand that schools need money to run. But we also understand that people can't start their adult lives in $40,000, $50,000 worth of debt after 4 years of university. So we're looking to do student loan debt relief up to $20,000 for people. We're also looking to give graduates a 5-year freeze on their debt so they can spend that 5 years working, getting into homes if they want, whatever they want to do. And then after that 5 years, then they need to start paying that loan back. So it gives them a bit of breathing room instead of coming straight out of college and university and having their debt payments come out immediately.
So here's a rather more personal question that's come up. Are you vaccinated, and what's your opinion on mandatory vaccination?
Yeah, that's a big question. I get that question a lot by email. I am fully vaccinated. My son is fully vaccinated. I work in a hospital, and as soon as I could get the vaccine, I did. I encourage everyone to get the vaccine because it is what is saving lives right now. We know that anyone who gets COVID, having had the vaccine, that it's very, very mild symptoms, even with the Delta variant right now. I'm also really excited. I understand there's some hesitancy out there, and I'm excited that the Ottawa Hospital is doing quite a bit of research. They're just finishing a 1-year study of people and vaccinations and any sort of side effects and how long the antibodies last. So I'm really excited for that information to come out. Hopefully it will put some people at ease to want to get the vaccine. And people, I'm just going to add to that. I know you didn't ask this, but I am going to add to it because I am hearing a lot about it. People saying, well, you know, they're talking about a 3rd booster, they're talking about a 4th booster. Let's be clear on that just for a minute. There are people on specific medications that their bodies are struggling a little bit to build antibodies, and they're asking for those 3rd doses. They want those 3rd doses. They want to be protected. Those are the people immunocompromised, organ transplants, people on chemotherapy. They're getting those 3rd doses already, and they may need a 4th dose. And we're not saying, from public health isn't necessarily saying that everyone needs that 3rd and 4th dose. It is misinformation at this point, but there are some people that do need it and they're looking for it. So just wanted to put that out there because people have been asking. So my opinion, everyone should be getting vaccinated. And with the vaccine passport, I know this is provincial. With the vaccine passport, I also think there should be a vaccine exemption passport because there are people that cannot get the vaccine and they shouldn't be completely alienated in this process because they can't get the vaccine for good reasons.
Thank you for that. So it's just 7:30. We're partway through this town hall. So Melissa Coenraad is your NDP candidate at Kanata-Carleton. My name is Alex Cullen. I'm your moderator for tonight. If you do have questions, please submit them through the chat. And I do have a question from the chat that has to do with the NDP position on capital gains. What is the NDP position on capital gains?
I'm sure the question is about capital gains taxes because I have been getting that question since that part of the platform did come out. So I'll just explain it in this way. So the NDP has no interest in extra capital gains tax on your primary residence. Okay, it's on secondary residences. If you have a cottage, if you have a house in Montreal and a house in Ottawa, whichever is not your primary home, when you sell that home, the profit of that home minus whatever you owed on that home is subject to extra capital gains tax.
Well, that's pretty straightforward. There's another question on health. This is not the first virus we've had in the history of humankind. It's a nasty one. It took some time for all the health systems to get coordinated, but it's not going to be the last one either. What lessons can we learn from this in terms of being better able to respond to it, mobilize our resources, and be more effective in protecting people?
Yeah, so I think that, I was around with SARS. I had just started my career when SARS happened, and I was working at the Civic Hospital and went through very similar kind of entrance that we did now. You had to prove you worked there, show identification, make sure you didn't have any symptoms. It was very similar to what we have to do with COVID going into the hospital now. And at that time, we had a better stock of PPE. We didn't have enough, but we had a better supply. And so I'm surprised, having gone through SARS, it didn't last as long. I understand that it wasn't as deadly as this, but I'm just surprised that the hospitals didn't maintain those levels of PPE, understanding what it took to get them the last time. And this was 100 times worse. But I think that we need to do a better job of maintaining PPE for staff for in the event the next thing comes along. And it's N95s, it's gowns, it's gloves, it's visors, it's everything that we needed the last time, we needed this time. I think that it also showed us from a hospital perspective, the lack of capacity that we had, or I don't even want to say lack of capacity, the lack of family physicians that we have that brought a great number of people into the emergency departments. And that is a big issue that we have. And I understand that that is primarily provincial, but we need to have more family physicians. Every Canadian should have a family physician. Every Ontarian should have a family physician. There shouldn't be 10-year wait lists for family physicians, because that will keep people out of hospitals. So I think we kind of saw those lines really blurred between emergency care and kind of continued care. Right? So your family physician, your healthcare practitioner is your continuous care practitioner. And then the hospital should really be for emergencies. We saw huge deficits in long-term care, which we all know about. And that still comes back to underpaid staff, major dividends being paid out in for-profit areas where they didn't want to take that money and invest it. We need to have a senior strategy for that. We need to have a long-term care kind of debrief after the fact. They need to be mandated to a minimum standard of care. We've been advocating for 4-hour, having enough staff for every resident to get 4 hours of care every single day. I know that's very provincial, but I think federally there are some things we can do about that as well, so that our loved ones are taken care of. And I think that, we learned a lot about lack of internet connections to rural areas when they had to homeschool and work from home. It was a big, big problem that those infrastructures are not in place. And if you look at some of the medical care now being over Zoom, just like we are here tonight, and that's something that we can take into rural communities. That's something that they can now have more access to medical staff in rural communities, but we need to make sure they have that internet connectivity to get them that virtual help and that virtual health out into their areas. So there's a lot of things we can learn from it. There's definitely some we're in the fourth wave, so we're not there kind of post-pandemic. I always try to rush it post-pandemic, but we're not quite there yet. Our numbers are unfortunately going up right now. But when we get to that post-pandemic, I think that there needs to be a debrief of what went right, what went wrong, and how do we prepare for the next time? Because, I can tell you from my experience, I did work at CHEO during COVID, testing COVID-19 swabs for almost a year. It was exhausting. It was learning like drinking from a fire hose, and we did manage through it, but I think that there's a lot of things that can be done from my perspective. And I think that there's a lot of things that can be brought to a big round table from all other perspectives in the hospital as well.
So we're getting a number of questions now. The question here about mental health, particularly how it affects the LGBTQ plus and trans community. Does the NDP have anything to offer with respect to mental health?
Yes. So we know that the LGBTQ2 plus and transgender communities are hard hit with discrimination and stressors and struggles in communities, along with Indigenous people, people of color, immigrated people, children. There's an astronomical number of mental health issues with children in the last couple of years. And all of this has shown us the massive deficit of mental health resources that we have in our communities. They're just not available. They're not available. People are looking to hospitals to get mental health help, and they're being put on wait lists that don't help them right now. We need to get family physicians that can help refer people to mental health community resources. We need to invest in this, and we need to invest in this right now because it's not available. And we need to look at why it's not available. Is it all public? Is it all that they expect people to pay $200-300 an hour to get mental health help, which seems to be the case in a lot of areas? And if that's the case, then we need to fund that so it is publicly available, because mental health help is just as important as pharmacare, is just as important as clean drinking water. It affects everybody, and it's all a part of the package of keeping people healthy. We need to keep people healthy, keep them happy, keep them productive, keep the economy going, make sure that everyone is taken care of. I think the other thing I want to mention with this, since the question was very specific about LGBTQ and 2+ and transgendered peoples, that the NDP has really come out very vocally in changing hate crimes, changing the laws, strengthening the laws about hate crimes as well. And because right now, a lot of hate crimes are kind of being categorized as less than hate crimes, and they're not being prosecuted as hate crimes. So Jagmeet has been very clear that he wants to strengthen those laws so that hate crimes are prosecuted as hate crimes, and that social media avenues such as Facebook and Twitter and all the other social medias out there are held responsible for how people are vocalizing their lives and hate speech online, and that they will be held much more accountable in taking it down. And he wants to have laws in place that is enforceable so that we can have that taken down, because we don't have that right now. It's all just falls under freedom of speech, but hate speech should not be under freedom of speech.
So here's a question about the opioid crisis. The opioid crisis has become even more worse during the pandemic. How do you think the NDP can utilize the social determinants of health to make gains in preventing problematic use of substances?
Yeah, this is a big one. We've seen that this really just kind of skyrockets, and it comes back to having mental health helps available for people, so they're not just turning to opioids or any drugs to get through whatever they're going through. I think that we need to have rehabilitation centers available, because right now they're all private, you have to pay for them. And the issue with a lot of these is you have to be sober before you can be admitted into a lot of these treatment facilities, which is really hard for people. So we need that in-between avenue for people as well, to be able to come into a facility, a hospital, a clinic, get sobered up so that they can then be admitted into treatment facilities. And that is a very long-term plan, because you don't just get treatment and then it goes away. Addictions are lifelong struggles for people. People relapse, and we need to have those continued community, social, programs available for people, kind of like AA, if anyone's gone through that or knows someone that's gone through that, where you go, you get sober, you get help, you get steps, you get tools and mechanisms to help you stay that way, but you get constant check-ins, right? You get constant check-ins, and that is majorly lacking with drug addictions right now. And we need to have that available for people, because it is a lifelong challenge. It is a mental health challenge for people. And if we don't have that available, that cycle is just going to continue, and people are going to continue to really deteriorate on these drugs. So we owe it to Canadians. Again, it comes back to keeping people healthy, to have these resources available.
So a different question this time. What will the NDP do to help lower people's cell phone bills?
Yeah, that's a big one. We pay some of the highest cell phone costs in the G7. And actually, I'm just going to I have a little sheet here that compares some of them, and I haven't actually been able to pull it out and use it. Let me see if I can find it here. Maybe I can't. But anyways, it compares us to Australia, it compares us to the States. And let me just give you some of these numbers, because I was really surprised. I've never been to some of these countries, so I didn't know what theirs are like. But the average cell phone bill for just basic 100 calls, 500 megabytes in Canada is about $38, $38 to $40. We're not talking about data here. We're just talking basic. In Australia and other OECD countries, the average is $19 to $20. Okay, so we're over averages. And then as the plans go up, ours are 47, theirs are 20, ours are 58, theirs are 23. So as our plans go up, that margin gets bigger and bigger and bigger. And we're one of the most expensive. So Jagmeet is going to, he's talked about really bringing us back to that average. He wants to bring us back to that average, and making the telecom kind of consumers' bill of rights is what they're looking at, so that they'll have to keep us to that average. Now, other people have asked, well, why wouldn't you just bring in more competition? And we could do that, let's be honest, but Rogers and Bell own almost all of the cell phone lines in Canada between the two of them. And people say, yes, we have Fido, yes, we have this. They all rent lines from Rogers and Bell. So we can bring in competition, we could do that. It's not really going to help lower it. So the Telecom Consumers Bill of Rights is going to force these companies, it's basically going to cap what they can charge Canadians for cell phone bills. If you go over to Quebec and you get a cell phone plan over there, it is cheaper than if you cross the bridge into Ontario. So even province to province, there is a big difference. So this would cap what they're able to charge you for cell phone bills.
Okay. Another question more local to Ottawa, and that has to do with water quality and municipal infrastructure that's aging, and sewage being dumped into our rivers.
Yeah.
Is there a role for the federal government there? What would the NDP do?
Yeah, there's definitely a role there. We need to clean up our waterways. Why is it acceptable to dump sewage in our water? I don't know who thought that was a good idea. I don't know why that's being allowed, but the NDP government wants to make an environmental bill of rights, and it's going to have to do with cleaning up our waterways. There's going to be regulations on things just like dumping sewage into our water that is not going to be allowed. It's going to relate to reforestation, planting more trees, having a certain percentage of trees, because all of our old growth forests are all being cut down. And, that's hundreds of years of trees that, as we know, helps clean our air, gives us clean air to breathe. And we're losing that as cities expand, and we're losing that as green spaces being sold off to developments, and we need to protect that. So this Bill of Rights is going to protect that, and it's going to force us to clean up our waterways, regulate what's in our water, and make sure that we have enough trees and enough green space in every city to make sure that we can keep the air and the land and the water as clean as possible.
So a very different question now on gun control. This is a topic that's come up recently. The Conservatives seem to be backing off the ban on assault weapons. Where does the NDP stand on gun control?
Yeah, so this comes up year over year, and I grew up around guns. My entire family hunts. It wouldn't be a Sunday without my dad and my uncle cleaning guns out on my table, on our kitchen table, and shooting out in the backyard. I didn't grow up in the city, so don't worry, we weren't shooting at our neighbors. We had tons of acres of land way out in the country. And so in my opinion, and what has generally been proven, that lawful gun owners are not the ones committing crimes. It is the contraband weapons coming in, being smuggled into Canada, the handguns. It is very hard, not impossible, but it is hard. There's a lot of loopholes. There's a lot of red tape for people to get hunting rifles. There's even more red tape for people to get handguns in this country. So we don't need to make that any harder for people. What we need to do is invest in getting illegal guns, illegal weapons off our streets. We need to find out how they're getting in. How are they getting into this country? This is not a new problem. We need to invest in that. We need to strengthen the ability for our border agents to be able to stop these weapons from coming in. And we need to, make sure that we're firm on our stance with it. I know that the Conservatives have kind of gone back and forth. I know that O'Toole had something in his platform, changed his mind. He's now gone back a little bit. So we need to have a stance and we need to be firm on it. And I know that the Liberals have banned assault rifles, and then they offered a buyback program and they didn't follow through with it. So a lot of people have said, I have these guns, I legally can't use them, but I paid all this money for them and I can't just get rid of it. So the NDP would be definitely re-implementing that buyback program for these weapons, because people shouldn't be stuck with them because they can't use them right now. And so that's something that they've committed to. And then they've committed to investing money into ensuring, but really shoring up that these illegal handguns are not coming into the country. But we don't plan, I just want to make it very clear, we don't plan to make it harder for people, for legal gun owners.
Another question about COVID and vaccinations. We're in a federal government town. Should vaccinations be mandatory for frontline workers?
So I work at the Ottawa Hospital, and it's mandatory for me to have my vaccine. I have to have my vaccine. I had to have it by last week if I wanted to keep working. So my whole team is vaccinated. I can't speak for other frontline workers. I know that 90% of the Ottawa Hospital frontline workers are all vaccinated by choice. And the question becomes, again, are there religious reasons people aren't getting them? Are there medical reasons people aren't getting them? But I think that everyone should do their homework, get educated on these vaccines, not only to protect yourself, but protect your patients. I know for me to even go to school for the program I did, there were mandatory required vaccinations because I'm working with pure culture samples like yellow fever, and I had to get these vaccinations to go into this program. There wasn't a choice, and I could choose not to get them, and I could choose not to do this program, and I could have done something else. But I think that mandating vaccines is something that we have already in our school system. You have to have your child's vaccines in order to send them to school. It's not new. Nobody likes to be told they have to do something. So I think we need to educate people on why it's the best choice, if it's the best choice for them. But if hospitals and employers choose to have their staff be vaccinated, I mean, there's a big choice there to be made. If you choose not to get vaccinated, it is your choice, but it's coming down to, they really have the choice not to have you work, I guess. I mean, there's a lot of that out going to courts already, and I'm not sure how that's going to work out in the wash, but I would just encourage everyone to get vaccinated, every frontline worker to get vaccinated. I know I was very stressed. I had 2 exposures in the COVID lab from pure culture COVID, and there was 8 of us that had to get tested. We had to isolate, and it was very stressful. I wish I had the vaccine then, because these exposures in hospitals are very high. There's a high risk, and you don't want to. I knew that I was super stressed to bring it home to my son. So
with this election, being called, and many people have questioned why this election was called, but we have it, and it doesn't look as if we're going to have a majority government. Has the NDP decided what party to support in a government?
Right. So the NDP is not about supporting the other parties. It's about supporting what's in our platform. If one of the other parties is trying to accomplish something in our platform, we're going to support that party. If the Conservatives want to push through pharmacare, for example, we're going to help them push through pharmacare. If the Liberals wanted to push through more affordable housing, we're going to help them with that. We're going to support any party that's trying to accomplish our platform or anything on our platform for the betterment of Canadians. And it's not about aligning with a specific party, one or the other. We have our goals laid out in our platform, and those are what we're going to advocate for.
So I guess the example is there's a very different approach on childcare between the NDP and the Conservatives. The Conservatives are proposing to drop the public plan that 8 provinces have signed on to, that the NDP has campaigned on for many elections, and offer tax breaks instead. Would you, if they form the government, would you support such a program?
No. We wouldn't. That's not going to help. We know that people are concerned about that. I've heard from many parents that they're concerned about that they count on those daycare programs month over month, not a tax credit at the end of the year. I mean, that just shows that the Conservatives are continuing to prop up the wealthy. Wealthy people can afford that. They can afford, $2,000 worth of daycare every month and, get a nice tax credit at the end of the year. The average Canadian can't. They need the daycare programs. So to completely abolish what's already in place, I can tell you a very personal story of myself. I was a single mom when I had my son. I was working full-time at the hospital, had a great job, making good money, and my daycare was more than my mortgage. And I finally had this moment of, I understand why educated women with full-time jobs literally can't afford to go back to work. I could not afford to pay my mortgage, pay my daycare, feed my child, and go back to work month over month. I would have been in the minus. Without the daycare programs, I would have been finding another job or on EI or on social assistance instead of being a productive member of society at work just because I had a child. So people need the childcare programs in place to be able to go to work.
So folks, it's almost 8 o'clock. So we're going to be coming close to the end of this session, but still another question. The gas tax revenue, the federal gas tax revenue, a share of it goes to municipalities. This is actually something that Jack Layton negotiated with a previous Liberal government years ago, and Stephen Harper kept in place. What is the NDP position on maintaining that or even expanding that program?
For the gas tax going to municipalities.
A share of.
Yeah.
Currently, there is a share going there. And,
yes. Yes. I mean, we need to maintain that. The municipalities need the money. They need it. They need it now more than ever. We definitely need to maintain programs like that so that they can go back into social services. They can go back into even, maintaining roads. As we know, we are the pothole capital of the world, I think. And things like that help to not raise property taxes. We've had 3 property tax hikes in the last 2 years, I think, 2.5 years. And so giving that money back to municipalities is really an advantage to the municipalities and to the residents.
Great. So we've covered a lot of ground here with all these issues. What are you hearing at the door What are the residents of Kanata-Carleton telling you?
I'm hearing a lot. I'm hearing a lot of things at the door. I'm hearing, why are we in this election? It's probably the number one thing I'm hearing. Why are we here? The governments were working really well together. I'm frustrated that we're in a pandemic still and we're in an election. I'm frustrated that we're spending $600 million on a $610 million to be exact on an election that none of the parties wanted except for, the Liberals, it seems. And so I'm hearing that first and foremost. I'm hearing about pandemic recovery. I'm hearing a lot about strategic voting. And really my response to people is, have your say, get out and vote. You need to get out there. If you're displeased with the current government, vote differently. I mean, that is your right. That's why we're here. They were looking for support, it seems. They're looking for a majority government, it seems. They're not saying it, but I'm sure if the Liberals had a majority government, we would not be in this election right now in the middle of a pandemic. So, that's what I'm hearing a lot about. Other than the obvious things, climate, daycare, getting the economy up and running, all the things we've talked about tonight. But outside of that, I'm hearing frustration. I'm hearing concern about, no, I'm going to leave it at that.
Well, that's great. Thanks very much. So folks, it's now 8 o'clock. I want to thank everyone for their questions. It's been a wide variety of questions. I'd like to thank Melissa for taking the time to answer these. You have a week to make up your mind who to vote for, and whoever you vote for, please make sure you do vote. So I'd like to thank everybody for participating tonight. You can address questions to Melissa directly using your email, and your email is, Melissa.
It's Melissa.Coenraad, and my last name is spelled Coenraad @ndp.ca.
Great. So thanks very much, folks, and hope to see you on Election Day. Polls open at 9:30 in the morning, close at 9:30 at night, and they do practice social distancing, so be aware of that as well. But anyone in the lineup, by the time it closes, will be able to get to vote. Thanks very much, people. Good night.
Thank you, everyone, for your time.